Module Overview. Understanding diagnostic and procedural terminology is essential for anyone entering the healthcare field. These terms are the linguistic foundation that allows healthcare professionals to accurately describe tests, procedures, findings, and patient progress. This module introduces you to the standard language used in diagnostics, imaging, pathology, surgical procedures, and clinical interventions, with emphasis on how these terms appear in electronic health records, EHRs, referral documents, and insurance billing systems. This module not only breaks down the structure and meanings of commonly used diagnostic and procedural terms, but also demonstrates how these terminologies differ across healthcare systems in Canada, the UK, and continental Europe, ensuring international relevance and professional accuracy. The content is aligned with global medical coding systems such as ICD-10, CPT, and SNOMED CT to prepare you for accredited clinical practice and documentation. 1. Introduction to diagnostic terminology. Diagnostics involves all tests and screenings used to identify diseases or monitor health conditions. These include laboratory tests, e.g., blood work, urinalysis, imaging procedures, e.g., X-rays, MRIs, CT scans, biopsies, endoscopies, functional tests, e.g., ECG, EEG, spirometry, common prefixes, roots, and suffixes in diagnostics, hemo, hemat, hun blood, cardio, heart, neuro, nerve, gram, hun recording, scopy, unviewing, examining, meter, measuring instrument, biopsy, removal of tissue for examination. Example, electrocardiogram, ECG, a recording of the heart's electrical activity. Gastroscopy, visual examination of the stomach. 2. Understanding common diagnostic tests. 1. Test. 2. Purpose. 3. Term complete blood count, CBC, measures red and white cells, hemoglobin. Hematology electrocardiogram, ECG/EKG, assesses electrical heart function. Cardiology, X-ray views bones. Lungs radiography MRI, magnetic resonance imaging. Detailed soft tissue imaging. Radiology biopsy tissue sample for pathology colonoscopy, examines the colon gastroenterology. 3rd key procedural terminology. Medical procedures range from minor outpatient treatments to complex surgeries. Understanding procedural language includes suffixes commonly used: ectomy, surgical removal, appendectomy, otomy, cutting into, tracheotomy, plasty, surgical repair, rhinoplasty, centesis, puncture to remove fluid, amniocentesis, decies, binding or fixation, arthrodesis, prefixes, arthro equals joint col, equals bile or gallbladder, rhino equals nose, hyster equals uterus. 4th, common diagnostic and procedural abbreviations. Abbreviation meaning CBC complete blood count, CT scan, computed tomography scan, MRI, magnetic resonance, imaging CXR chest, X-ray, ECG, EKG, electrocardiogram, USG ultrasound EEG, electroencephalogram, BX biopsy, LP, lumbar puncture, echo, echocardiogram. 5. Cross-regional diagnostic practices, Canada, UK, Europe. Canada. Diagnostics and procedures are billed using CPT codes and documented with ICD-10-CA, Canada specific. UK, NHS. Uses read codes, SNOMED CT, and supports patients via NICE guidelines. Europe, EU. Relies on ICD-10 and UMLS standards, with specific diagnostic practices governed by local medical bodies. Understanding these systems ensures interoperability, accurate data exchange, and seamless patient transfers across borders. 6. Medical documentation and coding. You are introduced to how diagnostic and procedural terms are transcribed into EHRs used in insurance claims, documented for clinical audits, integrated into telehealth communications. This aligns with international medical documentation standards to support quality assurance, billing compliance, cross-border referrals, accreditation, readiness. Learning outcomes. By the end of this module, you will be able to Identify and decode standard diagnostic and procedural terms used in clinical environments. Understand the structure and components of medical test and surgery terminology. Interpret common medical abbreviations related to diagnostics and procedures. Navigate the differences in documentation standards across Canada, the UK, and Europe. Apply correct terminology when reading patient charts, referrals, lab results, and procedural notes.